brief remarks. Reporters who have questions during the briefing may also submit those to the Task Force Public Information Contact, and we will attempt to address those during the briefing or as quickly as possible after it concludes. I'll now turn it over to Dr. Alex Garza.
Okay, thank you, and good afternoon, everybody.
YouTube after the course, and so you're welcome to see those. I am so passionate.
Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media.
Okay, thanks everybody, and apologize for that technical delay. But good afternoon and welcome to our task force briefing today. I hope everybody's having a great day so far. I know that many of you are starting to enjoy your extended weekend and celebrating that July 4th holiday a little bit early. As most of you know, or as I think everybody knows, at 7 o'clock this morning, the universal masking policy went into effect in St. Louis City and St. Louis County. And I again want to reiterate how important this is and how it takes everybody doing their part to prevent another surge in coronavirus cases. One easy and effective way to do this is by wearing a mask when you're in public. COVID-19 has not gone away. It's still circulating across the country and in our community as well. And it's making people sick, and we want to avoid spreading as much as we can. So let's get to today's data, and then I'll take some questions from the media. So again, here's the chart showing our hospital admissions. And again, the blue line shows our 7-day rolling average in daily new hospital admissions since early April. And you'll notice that after hitting a low point earlier in the month, we are seeing that rolling average start to creep upward, which is concerning. Today we report 24 new COVID admissions, bringing our rolling average up to 19. Now that's the highest our rolling average has been for admissions since around June 4th. And it's concerning that within the past week, we've had multiple days with greater than 20 admissions for COVID across the metropolitan area. Now, while we're happy that the number is still manageable, it does lead us to believe that there's increased transmission occurring in the community right now. And we'd like to get that back on the downward slope and keep that number as low as possible. And as I have said before, this number will not reach zero until we get the vaccine and then probably sometime after that. And so the key is to keeping the number low is to prevent spread in the community. Moving on to our hospitalization numbers now. So our hospitalization numbers are starting to show an increase as well. This chart represents our daily hospital census of COVID positive patients only. And as you can see, that 7-day moving average blue line that has been flat for at least several weeks is now starting to tip upward. Today's 7-day average sits at 145, which is up from 142 yesterday, and from 139 when we last spoke on Wednesday. Today's overall hospital census climbed today as well. Today it's at 159. Now let me update you on some of our daily hospitalization numbers. And again, these represent COVID positive patients only and do not include patients that are suspected of having COVID. As I mentioned previously, there are 159 hospitalizations today of confirmed COVID patients, which is up from 153 patients yesterday. We have 44 confirmed COVID patients in the intensive care unit, which remains unchanged from yesterday. And we have 23 confirmed patients on ventilators, which is up from 21 yesterday. For our suspected COVID patients, we currently have 107 people in the hospital with suspected COVID. 8 of those patients are in the intensive care unit, and 4 of those patients are on ventilators today. And now for our good news slide. The Task Force Healthcare Systems discharged 21 patients yesterday, bringing our cumulative total to 2,946 COVID patients discharged from the hospital. And again, this is a testament to all of our outstanding healthcare workers and everyone else who keeps the hospital running to get these patients better and back home with their loved ones. And a special thank you to all of them for working this holiday weekend as well. So I'll conclude my remarks here with this slide that we've shown you before. So as I've mentioned during our briefings on multiple times and during our hospitalization numbers, we're seeing an increase in our admissions, which is concerning because this means that there's an increase of spread of COVID in our population. No doubt everyone has seen what's occurring around the country with record numbers of cases and hospitalizations. Now, we do not want that to happen here. We don't want to see the exponential growth of cases that we're seeing in other parts of the country. We don't want to have our healthcare systems overrun. We don't want people to needlessly die. And we don't want to have to shut down our communities. And in order to prevent these things from happening, we have to prevent spread in the community. This slide again shows all of those things we all need to be doing right now to avoid the spread of the virus. And I'll repeat them once more. Practicing social distancing, so staying 6 feet apart from anyone that's not living in your household. Wearing a face mask in public at all times, particularly indoors and when when you can't socially distance outdoors. Wash your hands for at least 20 seconds with soap and water and do it frequently, or use an alcohol-based hand sanitizer. Monitor yourself and your family for signs of the virus, including sore throats, fevers, coughs, any of those symptoms that we've all come to know. And if you are having symptoms, stay home, avoid contact with others, and get tested. Keep the surfaces clean thoroughly and stay home if you are vulnerable. And please keep your gatherings low enough for enough space to be allowed and to allow social distancing, particularly during this holiday weekend. So to wrap things up, I know it can be alarming to see our numbers growing instead of decreasing. However, how this all plays out is entirely up to us as a community. There is a reason why we put Stop Spread first in our slogan, because you have to stop the spread in order to save lives. Now we'll continue to watch the data and keep you updated on the trends we're seeing, particularly after the holiday. Now, I want everybody to have fun and be safe, but do those common sense things. Like wear your mask, stay socially distant, wash your hands, and I would particularly avoid any congested venues. We all play a vital role in keeping our community healthy, and the virus doesn't take a holiday. And now we'd be happy to address some of the questions that we have received from the news media.
Some people are pushing back on the mandate to wear masks. Can you comment on how they provide protection and the role they'll play in preventing a surge in cases like we see in other states?
Yeah, that's a good question, and one that I hear frequently. And so the way that I would address it is from time to time, we ask society to do things to protect the community. And so things like wearing seatbelts, prohibiting smoking in restaurants, having our children vaccinated before they go to school, and having healthcare workers vaccinated. And the reason why we do these things is because there's clear evidence that these are really low barrier things that we can do to prevent disease and even death in the community. And these are pretty small asks, I think, in order to protect the community. But let me give you a couple of other reasons why mask wearing is so important. As we said earlier in this week, economists from Goldman Sachs had detailed how this was one of the easiest ways that we can prevent any more economic harm to our communities, because the alternative is to start shutting businesses down or do shelter-in-place orders. And economically, that hurts everybody, particularly the vulnerable. Now, a lot of studies have shown the benefits of mask wearing, and one in particular showed that if we get a significant number of the population, upwards of 80–90% of people wearing masks consistently, that we can keep transmission low. By that I mean below 1, and so you've heard me talk about the R naught. If we can wear a mask consistently, we can keep that number below 1. The other reason I would say is I've heard a lot about personal freedoms, things like that. So in some ways, though, I would argue that a mask actually enhances your freedoms, because then we're not closing down businesses. We're not doing shelter-in-place orders because we've prevented transmission. And so it actually enhances your freedoms by allowing you to do more things and to keep our communities open. And again, it's a small ask for us for the community, to protect the community. And if none of this really convinces you, then there's a mortality argument that can be made. Some researchers from the University of Washington showed that if 95% of Americans consistently wore a mask, that we could prevent around 33,000 deaths across the United States by October. That's a huge number of lives, and that could potentially be one of your loved ones. And so please, everyone, just wear a mask.
How should people keep themselves safe during the holiday weekend?
Doing all of those things that we've listed previously. So wearing a mask, washing your hands, social distancing, avoiding crowded venues, particularly those that aren't well ventilated, things like that. All of those really common sense things that we've been preaching for the last couple of months are the ways that you can keep yourself safe.
Is there a testing slowdown right now that is impacting any portion of the St. Louis area? There are some national reports that Quest Diagnostics is experiencing slowdowns in returning test results because they are near or past capacity. How long is it taking people to get test results in the St. Louis area?
So there have been slowdowns in testing capacity out in the community, and particularly with some of the national labs. And so as we've spoken about frequently during the pandemic, testing still has not caught up to demand. There's absolutely an increase in the amount of testing, but now with this increase in surge across the country, it's putting a tremendous strain, particularly on these national labs. And so the turnaround time is what we describe from the time that the sample is taken till you get the result back has increased. And I've heard from our community partners that this has gone anywhere from 1 to 2 days to the upwards of 10 days, which is worrisome. And the reason for that is you're trying to make decisions on what you should be doing regarding the virus based on the information that you have. And so if the information is delayed, that puts you that much farther behind in making those decisions. Now, in talking with some of our community partners, there are plans in place to shift labs so that we can get faster turnaround times. And from what we've heard from these labs as well, they anticipate having the capacity built up within the next couple of weeks in order to support all of this increased testing that's going on, not just in St. Louis, but around the country. But as everybody knows, 2 weeks in a pandemic can be a lifetime. So from the healthcare systems, we run our labs within our own laboratory facilities, and so we haven't been as impacted by that. Those national labs mostly are for ambulatory or outpatient care.
Can people under the age of 17 get a test easily, or are there age restrictions at testing sites that lead to an undersampling of juveniles?
As far as I know, there are no age restrictions for getting a test. So anybody from any age should really be able to get a test. I can't really explain why the age differences are, other than younger people frequently are asymptomatic, and so that probably drives a little bit of that, where if they aren't feeling ill, then they're not going to go and get tested. So that probably contributes somewhat to that.
Some political conspiracy types are saying hospital and states are making up COVID deaths to collect more money. Do you have any response to that?
Well, I can see how it's tempting to make a correlation between a COVID diagnosis and increased payment. And particularly because CMS, Medicare, does pay more for a COVID diagnosis. But that doesn't really translate into fraud on the part of the healthcare systems. So the way that it works is, first of all, you have to have a diagnosis of COVID from a clinician, and then a medical coder who's a professional who goes through training and certification to code has to be able to substantiate a diagnosis. And so they use a strict set of criteria when they're assigning a diagnosis code. And if there's not documentation to support the diagnosis, then they won't code for it. And I can tell you from personally working with them in the past on things that even outside of COVID, they will not change a diagnosis unless it's supported in the documentation. And why is that? Well, that's because the healthcare system is frequently audited by CMS for accuracy in our diagnostic coding. And if there are errors in the coding, whether they're intentional or even unintentional, the healthcare systems are fined for that, sometimes to the tunes of millions of dollars. And so there are a lot of checks and balances that are in place to ensure the accuracy of the coding and that the documentation and the testing supports the diagnosis of COVID. And we haven't seen really any evidence to support that people are upcoding or fraudulently coding for COVID patients around the country. And everybody understands, at least they should, the healthcare systems understand, that more than likely we're going to get audited for COVID by Medicare. And so even if you were thinking about fraudulently billing Medicare, it's really in our own financial best interest not to do that, because we know that we're going to be fined and have other penalties against us. And so, even before COVID, there's fraud that occurs. And I'm not going to say that we won't see some at the end of the day, but I do believe that'll be very rare.
That concludes the list of questions received from members of the media prior to today's briefing. Thank you for tuning in and have a wonderful holiday weekend.